Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University. And you know, we have the privilege every once in a while, we do all these healthcare shows and tell you how to take good care of yourself. But you know, every once in a while we like to do a healthcare of the community show. And what is more healthy in a community than to bring back the folks, particularly the leader, the manager of our animal-assisted therapy program at the Broward Humane Society. And that's, I'm going to say, I'm going to make you a doctor, but you're not a doctor, but in my mind you are. Marni Bellavia. And Marni and her two wonderful therapy dogs, Karma and Sydney. And look at how quiet they are today. Hi, Marni.
Hi, how are you?
Good to have you. And why do we say it's the healthcare of the community? Because the kind of work that these people do make our community so much more healthy, so much more kind and loving. And I want you to pay attention to hear what they do and how they do it and how we can help them out. And in front of me is a gentleman that comes from Boca Raton and found out about this particular program after he was looking to do something with a therapy dog through Dateline Health, I just found out. Alfred Sklarew and his dog, beautiful Augie, sitting down there. And that Augie also is a rescue dog.
He is.
Right. And that's a major issue. I mean, I bless all of you for, and these people out there feel the same way, for rescuing these animals. They see them on television and this and that, and they see how cute they are, or whatever. But, you know, people don't realize how abused and neglected sometimes these animals are. In fact, most times they are. And they're just abandoned. So the way I look at it, they're part of our human feature, part of our human structure. And being someone, and I've been very transparent to you, I have two wonderful rescue dogs at home, CJ and Cindy. So welcome, both of you.
Thank you.
Tell me, Marni, my friend and one of my all-time favorite people, tell me about the therapy assistance program, and so that any new viewers would understand what we do here in Broward County.
So our animal-assisted therapy program, we visit nursing homes, hospitals, retirement centers. We go into schools and educate children about pet care and responsibility, pet overpopulation, how to stay safe around animals. We have a Wags and Tails reading program that is in most all of the Broward County libraries and several of the Broward County schools. And the premise behind any of our therapy programs is to help people be more relaxed, feel more at ease. Dogs are non-judgmental, so they provide you with unconditional love and acceptance. And we have found that through use of dogs, people have lowered blood pressure, they have lowered cholesterol, they are getting more exercise because they have their animals, so they're going out in the community, they're walking them. And also that they become more social because they're taking their animals places. I'm always asked everywhere I go, what kind of dog is that? Where does your dog do therapy? What's therapy? And by way of that, you're communicating with the public. You're being able to reach out to other people and explain what you do with your animals and how it benefits humans and children and other animals and just a variety of different entities through way of our therapy program.
I inaccurately named the Humane Society, but it's the Humane Society of Broward County, just west of the railroad tracks. If you haven't had the opportunity, folks, to visit the Humane Society, take it upon yourself someday to go by and see the wonderful work that they're doing. The Animal Assistance Program is really a therapy program. So Alfred, if I may call you Alfred.
That would be fine.
Tell us about Augie, and then tell us about how you got involved.
Well, Augie is a 2.5-year-old long-haired dachshund, and we adopted him when he was just about 8 weeks old. And he just loves people. And I have a background in education. I was a teacher and a school principal in Montgomery County, Maryland. And I decided after retiring that I wanted to continue to give back to the community in ways that made sense and were helpful to people. So after getting Augie and realizing that he loved people so much, I thought if I could get into a therapy program with him where he could work with people and really help them, that would be a great thing to do. And I came across your program and the Humane Society of Broward County and Marni's wonderful work. And I called up the Humane Society and said I'd like to volunteer. And Marni assessed Augie and me and said, you guys are great, let's give it a shot. And we signed up immediately for the Wags and Tails program, where students are reading to us. I'm working right now in a school with Augie once a week with special needs students, and they absolutely love him and they read to him, and they're really improving their reading skills and their feeling of self-worth just by being with Augie once a week.
Well, you know, we've had the privilege of having Marni and the program on Dateline Health. I think this is our 4th time around, or 5th time, I don't remember, whatever it is. I wish it was more. Marni has always talked to us about Wags and Tails, amongst other things. So I'll let either one of you, Marni, why don't we tell people what Wags and Tails really is about, because you did, in your introduction, spoke about how these dogs are not judgmental, and I think that's a very important feature relative to what Alfred just spoke about with special needs children. So go right ahead.
So our Wags and Tails reading program is a literacy program, and it's geared to help children that are having problems reading, struggling readers, to feel more confident in their reading, to help them with their literacy skills. What we have found in utilizing the dogs in this program is that the children that may be embarrassed to read in front of other peers, or maybe they stutter, maybe they wear glasses, or they're just struggling and they don't want to read out loud, having the dogs there provides that non-judgmental entity that the children feel comfortable reading aloud. Even though there is a volunteer present, they feel comfortable reading to the dog, because the dog isn't going to laugh at them or tell them that they read the sentence incorrectly. So our reading program is really to help children become better readers through motivation of having the therapy dogs present.
And going back and thinking about your last discussion about Wags and Tails, you spoke of a situation where a child was wearing rather large lens glasses, and how perhaps some of the children in those lower grades were making fun of this particular person, and how the dogs really, in a sense, intervened when he was reading. Do you want to talk about that?
So a lot of times what happens is the children that are struggling in the various schools that we work with are the kids that are chosen for this program. And the dogs, basically, when they come in to read to this child, even though the child may be self-conscious of the way they look, the dogs don't see any of that. So all they see is there's a child sitting on the floor and they're getting ready to read to them. The way it is viewed amongst the other children is that they're no different than I am. So what that they wear glasses? This dog is reading to them. This dog, or reading with them, this dog loves them. And a lot of times we find that children, you know, their perspective changes when they're able to see that others are accepted without any prejudice. So we like to utilize our animals in a lot of different situations, and we find that in schools especially, where bullying is very predominant, the use of having the therapy dogs there kind of breaks barriers down for people that children may have not really liked another child because maybe they wore glasses, or maybe they didn't, maybe they weren't in the same grade as they were, reading at the same level they were, and then here comes this dog, and now everybody's like on the same playing field. And I really think that, you know, by use of having those therapy dogs in the classroom with the children, a lot of those barriers are then broken down.
That's good. And I would assume, Alfred, that that's what Augie is participating in. You see that all the time.
All the time. And not only does it do all those wonderful things that Marni just said, but Augie has had the experience of working with students who are literally just beginning readers. Sometimes their mothers come in with them and help them to get through these very early literacy books. And the children just love it, and you can see that they are feeling self-confidence as they go forward in their beginning reading. So that's just a wonderful thing. In addition to which, we had an experience at a library where a young adult who had autism, fairly moderate autism, did not read well, and his mom asked if he could read with Augie, and I said, of course. And to see this young adult express himself and get next to Augie and feel confident about something he was doing was just a beautiful experience.
Well, that's what it's all about. That's what it's all about. These animals are very special, but you're very special people too. Marni, Ms. Bellavia, the activities of the animals are well known to our viewing public because they see them in hospitals and they see them in some very difficult situations, children's hospitals particularly, and cancer therapy units. So let's talk a bit about that.
So our therapy teams, we, as you mentioned, work in various different hospitals. We work also with senior population. 10, 15 years ago, it was unusual to see a dog in a hospital. Nobody saw dogs in hospitals. Now that society has fast forwarded a little bit, got a little smarter, a little bit more educated, they see the benefits in having animals in these types of facilities, in these types of institutions. Our animals, when they go into places like hospitals, whether they're working with children or they're working with adults, whether they're in hospice care, whether they're just in the emergency room, it could be acute care, it could be anything. Immediately the vibe is changed. People are more relaxed when they see the animal, they're more comforted when they see the animal. So by use of the animal coming into those different facilities, we find that people are less anxious. They can be more relaxed. They can pay more attention to what is important for them to be doing at that moment. So maybe it's breathing slowly. So if they're hyperventilating, they're not breathing too fast. We find that in situations where we're dealing with end-of-life situations, a lot of times the dogs are comforting to the family members. So not only to the patients or the clients, but also to the family members in being able to give the therapy, being able to be pet. A lot of times this is what they do. They lay on their bed, they lay on their lap, they essentially may fall asleep, but the person is petting them or the person is near them, and they know, they feel animals gravitate to people in need, I believe. And they provide that unconditional love that people require and need and should have.
It's amazing how they know, because you know I know that I'm talking to people that understand this, but the people out here are wondering, you know, they say, boy, I see so many animals, mostly dogs, in facilities now. I had somebody talk to me just the other day about someone visiting a cancer therapy center at Joe DiMaggio Hospital, and there were, you know, a couple of therapy assistance dogs there. Is this unusual, or do you see this all the time?
No, we see it all the time. And, you know, my belief is that animals are natural born healers. If we let them do what they're intended to do, that's what they do. They're natural born healers. They're clowns. They're as transparent as it gets. What you see is what you get from a dog, from an animal. And when we go into those facilities, it is true. you are not going to forget you're in a hospital. You're not going to forget if you have a terminal illness or a broken arm. But for that moment in time that we're visiting, you do forget, because now you've got a dog that's snuggling up to you, or that you can read to, or that you can play with, or in many cases when we work with children, especially those that are in hospitals, if they can walk around the units with them. It gives them a break from the constant testing that they have to go through, and being in a medical facility, and especially for kids, it's difficult. They want to be outside, they want to be playing with their friends, they want to be doing things that kids do, and they're hospital bound. So even being able to have that dog come in and just provide that break in their routine of being in the hospital, being able to play with the dog, teach the dog different, or have the dogs do different tricks. A lot of our dogs know how to do things like beg or roll over or crawl, and that's fun for kids to do with them. And for that moment of time, however long they're there, they do kind of forget that they're in a hospital, and they are smiling and they are feeling good. And we have a lot of requests. We work in all the hospitals in Broward County and all the pediatric departments, the NICU units, the ICU, the ERs, the oncology units, and we see such transformation in people when we're there, that they do light up, they do become different people. They're grateful. They're so grateful that we came with our animals, and people like Alfred and I are so grateful that we're able to bring our animals along with all the rest of my volunteers. So to me, it's a win-win all the way around. Whether it's coming from us or coming from them, but animals definitely have tremendous health benefits, and they are, without a doubt, natural born healers.
Alfred Sklarew, you're a perfect example. First of all, congratulations on all the years of being a provider of education to young people.
Thank you.
I always say that academics, and particularly what we would generically call school teachers, people who teach from K through 12, you're really often blessings from a higher order. And I really am very, very thankful for the kind of work that you've done. I happen to know Montgomery County well because my brother lived in Maryland for a number of years, so I know the school system well. But it's such a wonderful thing for you to be able to now carry forward your intent of making people better by giving them knowledge and intellect, by giving them some, I guess you could say, palliative thoughts and opportunities through your animal assistance. So how do you feel about that?
Very rewarded. I feel blessed to have the opportunity to go into different places and help in any way I can. And I just wanted to piggyback on one of the things that Marni said in terms of the adult and senior populations. Not only does Augie go into schools and work with preschoolers and special needs students, but we have the wonderful opportunity to go into an Alzheimer's daycare center. And what's interesting there is that there are a number of people in those centers whose communication skills are lacking and their memory is obviously not good. And what is amazing is when Augie comes in and sits on a person's lap, it just brings back memories to those people, and they begin to talk to me a little bit about the pets that they had when they were children or growing up with families. And the smiles that he brings to their faces is just a wonderful sight to behold. In addition to which, not only does he bring warmth and positive feelings to the seniors, but the people who work in these facilities also get a benefit from our bringing our pets in. And you can see it in the way they interact with our assisted animal therapy pets. It's just an amazingly wonderful feeling, and I'm very thankful that I've been able to participate with Marni and the Humane Society in this program.
Yeah, I think we should not, under any circumstances, negate the fact that, we have the largest number of people in the United States, percentage-wise, over the age of 80 and over the age of 90 that are living in our state. And particularly Dade, Broward, and Palm Beach County, there are a great number of people that are living to that age. And many of them are in facilities where they just want to have some quality of life. And it seems to me that these animals are giving them an additional view of life and therefore giving them a boost relative to their quality of life. Is that the way you feel? Both of you?
Absolutely.
Right. Marni, the Humane Society of Broward County, tell me how some of our viewers that want to not only come to visit, which the place is open, they can come and visit, but if they're interested in doing therapy animals, how do they get in touch with you?
So our shelter is located at 2070 Griffin Road, just 2 blocks west of I-95. Our telephone number is 954-989-3977. The Volunteer Services Department number is 954-266-6814. So for anybody that's interested in becoming a volunteer, they would call Volunteer Services and inquire about, becoming a volunteer of our shelter. In the animal assisted therapy program, obviously the animals are trained, they are temperament tested to make sure that they will be suitable in all situations. We're always looking for volunteers. We have a lot of people are unaware of the amount of volunteer positions we have, but we have volunteer positions in our education department. We have them in our therapy department, at our pet boutique, in our shelter, in our kennels, greeters, adoption counselors. If somebody's looking to volunteer and work with animals, we definitely have a position that somebody can, volunteer for. And I also just wanted to mention, because we've been doing a lot of things with NOVA, and one of the things that I think is super interesting, besides everything else we've been doing in our animal assisted therapy program, is we've been doing a lot of stress buster events. So when the students are going through their exams, we come out for a few hours with our therapy dogs and we kind of give them a break during exam time. And we've been doing that for quite some time over here at NOVA and a few other colleges. We're also, as Alfred mentioned, starting to do it with some of our facilities with their staff members, because it's important, because people are stressed, to be able to bring those animals out and reduce the stress that they're having. So we're working in all different kinds of modalities with all different kinds of people, which is very rewarding in and of itself.
I think Sydney wants to come over to me.
Sydney might want to come over to you. Do you want her?
I think so, sure.
Okay.
Anyway, I very rarely would say this, but I'm going to say it. Here we go. Hey, Sydney, girl. There's always an opportunity, as I do, to help out, because none of these things occur without your support. So we're talking about financial support. So if you feel that you want to help the wonderful programs in the Humane Society of Broward County, don't be shy. Whatever it is, just find a way to send a little couple of bucks, whatever you want. I'm not asking for anything, but Sydney is, right? Sydney, right? Right. Anyway, Sydney's a star. This is the second time that Sydney's been on my lap.
I did.
Last time, Sydney, you were shedding all over me, but it was okay. It's all right. No, it's all right. It's okay. So again, I think that you ought to be aware of the fact that we are very, very fortunate to having one of the finest humane societies in America. Not in Florida, but in America, and maybe in the world, sitting right here in Broward County. Everybody tries to do their hard work, but this is a very special place, and this program is a very special program. And if you're interested, if you have an animal that you want trained or to be viewed by Marni Bellavia, just give them a call. We're going to put up the number so that you can call. And if you want to be helpful to the Humane Society of Broward County, don't be shy. We want to thank both you, Alfred Sklarew, and particularly Augie, and you, Marni Bellavia, a manager of the Animal Assisted Therapy Program at the Humane Society of Broward County. But we want to thank you for your kindness, for your attention, for your willingness to give other people happiness and wellness. And that's what this program is all about. Thank you all for showing up this week. And Sydney, thank you very much for showing me some love. But for some reason, you just are so well trained now that you won't lick me like you did last time. So, folks, I hope you don't mind that we broke a little with our tradition of providing discussions about medical processes and health care, but this is the health of the community, and we thank you for showing up. Remember, this is your show. It's called Dateline Health, and I always tell you to take good care of yourself, but in this case, I'll say take good care of yourself and take good care of the people who are walking next to you and behind you and in front of you. It's not your job, but these wonderful dogs don't make a decision as to who they can help, and they do it. So maybe if we take a lesson from these dogs, we can just be a little happier. Once again, my name is Fred Lippman. This show is called Dateline Health. We come to you from Nova Southeastern University, and until next time, see ya.